We're in the thick of flu season right now. Valley doctors are warning it's not over yet. As a matter of fact, we're kind of in the peak of it. So more than 30,000 people, they've already tested positive for the flu in our state since the start of the season, which was actually in October.
So 12 News journalist Gabriella Becerra explains the toll that it's taking on our hospitals and, more importantly, how we can stay out of the hospital and stay healthy.
You've either caught it or you're trying to avoid it.
Influenza is the one that's dominating.
Respiratory viruses are surging through Arizona, predominantly influenza A.
Specifically in Maricopa County, we've seen upwards of a 35% of increases in new flu cases, even in just the last week.
Sore throats, sneezing, runny noses, all of the symptoms that make people feel terrible.
The first few days literally are the worst symptoms for the upper airway, and then it goes down into the chest.
The problem is the flu can be tough to avoid.
Just being out and about is definitely an exposure risk because people are ill out there walking around.
According to the CDC, Arizona is in the red with a very high influenza-like illness level.
All of our emergency departments are overburdened right now.
Doctors from around the valley say their emergency rooms are filling up.
I worked yesterday and we had at least 25 patients in our waiting room for my entire shift there, even seeing a lot of people. There's just not a lot of space we have right now.
And urgent care centers too.
About 90+% of our patients are coming in with a common illness that's out there right now.
But flu season is something doctors prepare for every year.
This is what is expected.
And they say you should too.
Hand hygiene is one of the biggest tools that we have. Hand wash always.
Doctors encourage people to get vaccinated, keep surfaces clean, and do your best to stop the spread.
If you're sick, stay home because you probably have the flu right now. And if you go out, even if you're feeling ill, you're high risk of spreading it to other people, specifically older people who could get much more sick from the flu than if you're young and healthy.
Gabriella Becerra, 12 News Today in AZ.